Hello everybody, Dr. Rafy Wald here. I hope you are all doing well today. By request, I am going to talk to you a little bit about early onset dementia. So that term early onset dementia is a little bit of a loaded term because, as we have discussed in the past, it's not a specific disorder, but rather dementia is a sort of collect-all term that refers to some kind of a cognitive impairment, which can have a lot of different causes, the most common of which are Alzheimer's disease and vascular dementia. However, since our time is limited, what we are going to focus on today are generally, when people are talking about early onset dementia, most often they are referring to either frontotemporal dementia or Alzheimer's disease, though there are, again, many other causes of early onset dementia. So for our purposes, we're going to focus on these two causes of dementia. So technically speaking, a person suffers from early onset dementia if it onsets or is diagnosed before the age of 65. Anything after the age of 65 is considered late onset. Alzheimer's disease we have discussed in the past. Alzheimer's disease is generally characterized by amnesia, problems with your memory, aphasia, problems with your speech, and then later problems with executive functioning or sort of juggling information in your mind, and it degenerates. The average life expectancy is 8 to 10 years from first diagnosis. Then there's frontotemporal dementia, which is different because more often than not, certainly not always, but more often than not, it is diagnosed before the age of 70, very often between the ages of 50 and 70. And the hallmark of frontotemporal dementia, especially what we call the behavioral variant, is personality changes. Very often people will become disinhibited, they will become agitated, they will become apathetic. Also, people with frontotemporal dementia tend to have impairment in their language and executive functioning. So with frontotemporal dementia, generally speaking, the life expectancy is 5 to 7 years or so from first diagnosis. So obviously these are two different conditions, but I hope this information does help you. Great talking to you as always. I will look forward to talking to you soon. Bye-bye.